Hello, ladies and gentlemen. My name is Corey Johnson, and welcome to Relationship Management. Today's topic is going to be about trailer trash, Part 2. For all of the men that are pure at heart and is looking for the love of your life, I stand before you today as your mental therapist, teacher, and your attorney. And for some ladies that are suffering with mental illnesses, I stand before you as your psychologist, gynecologist, your counselor, teacher, and shrink. Shrink is another term used to refer to mental health professionals, including therapists, psychologists, and psychiatrists. Beware of devilish women. The definition of the word devilish means like or appropriate to a devil and evil, sexual immoralities with several men, a hateful person, fake, rude, pretends to be a Christian while at the same time calling her own self a slut in front of the world on Facebook, meaning she's a nymphomaniac, uncontrollable freak that makes it her business to stink up different men with her pussy odor due to pounds of multiple cum shots that she allows from having sex with anything that walks or anything that moves. She's a narcissistic person, a person of cruelty, and a lady of rebellion. She makes it obvious online that she enjoys devilish tortures with different men, and if you don't believe me, start checking out these types of women pages. My legal advice to you is avoid dangerous, because these types of women got a smelly cat, herpes, yeast infections, and a sour ass, filthy breath that has dick always stuck down her breath. These types of women drives or hangs out in the wee hours of the morning serving different men blowjobs. And these ladies are fuck monsters that wouldn't mind having sex because they rather make that easy money rather than find a real job. These types of women leave their underage children at home all alone while they go out to enjoy that dick. Always remember that just because some of them have a pretty face, that doesn't necessarily mean that their heart is right, because a lot of them have shit for brains. They're stuck on stupid, and they are pathological liars that will cheat on you, and the men that she has on Facebook as her friends is your replacement or her spare tires to fuck the minute she gets angry with you. I give you this professional advice because I want you to be careful. I want you to be wise and safe. Who you let move in with you inside of your house, because the wrong woman can give you the AIDS virus. Always remember that if a woman seems to always say unwise shit and always appear to have a fart stuck on her brains or something, leave her dirty ass alone. Meaning, stop trying before you get hurt. Beware of demented people. Demented definition is having wildly and irrationally on account of anger, distress, or excitement. A demented dangerous and sadistic. Nymphomaniac. Nymphomaniac definition is a woman with uncontrollable or excessive sexual desires. A person that would even go as far as fucking a dog or a horse if she have to. And due to this type of uncontrollable illnesses, these type of ladies would even go as far as fucking a child or having sexual desires for her own 10-year-old little boys. Fact shows online that teachers, female teachers, have sex with underage children that's under 15 years old, and the hours wind up getting put up in jail or prison behind this. Compulsive sexual behavior is sometimes called hypersexuality or sexual addiction. It's an intense focus on sexual fantasies, urges, or behaviors that can't be controlled. It causes distress and problems for your health, job, relationships, or other part of your lives. Compulsive sexual behavior may involve different kinds of commonly enjoyable sexual experiences. Example includes masturbation, sexual arousal, by using a computer to communicate, multiple sexual partners, use of pornography, or paying for sex, or selling her vagina for sex. But when these sexual behaviors become a major, constant focus in your life, are difficult to control, cause problems in your life, or are harmful to you or others, that's likely compulsive sexual behavior. No matter what is called or the exact nature of the behavior, untreated compulsive sexual behavior can damage your self-esteem, relationships, career, health, and other people. But with treatment and self-help, you can learn to manage compulsive sexual behavior. What triggers hypersexuality? Symptoms of hypersexuality disorder or sex addiction may include repetitive thoughts, urges, or behaviors that feels unmanageable, strong emotions such as depression, anxiety, shame, guilt, remorse related to behavior, unsuccessful attempts to change, control, or reduce fantasies or behaviors. The exact cause of hypersexuality is not known. It may be treated to a person's mental and physical health. Some risk factors may include living with another mental health condition, such as bipolar disorder. Bipolar disorder, also called manic depression, a disorder associated with episodes of mood swings ranging from depressive lows to manic highs. The exact cause of bipolar disorder isn't known, but a combination of genetics, environment, and altered brain structure and chemistry may play a role. Treatment can help, but this condition can't be cured. Chronic can last for years or be lifelong. Overview. This is an overview, ladies and gentlemen. Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to mania or hypomania, less extreme than mania, you may feel euphoric, full of energy, or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any at all. Although bipolar disorder is lifelong conditions, you can manage the moods. You can most definitely manage your mood swings and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with medications and psychological counseling, psychotherapy, more severe than hypomania and causes more noticeable problems at work, school, and social activities, as well as relationship difficulties. Mania may also trigger a break from reality, psychosis, and require hospitalization. Both a manic and a hypomanic episode includes 3 or more of these symptoms: abnormality, upbeat, jumpy, or weird, or wired, increased activity, energies of agitation, exaggerated sense of well-being and self-confidence, euphoria, a decreased need for sleep, unusual talkativeness, racing thoughts, distractibility, poor decision making. For example, going on buying sprees, taking sexual risk, or making foolish investments. When to see a doctor. Despite the mood extremes, people with bipolar disorder often don't recognize how much their emotional instability disrupts their lives and the lives of their loved ones, and don't get treatment they need. And if you're like some people with bipolar disorder, you may enjoy the feeling of euphoria and cycles of being more productive. However, this euphoria is always followed by an emotional crash that can leave you depressed, worn out, and perhaps in financial, legal, or relationship troubles. If you have any symptom of depression or mania, see your doctor or mental health professional immediately. Bipolar disorder doesn't get better on its own. Getting treatment from a mental health professional with experience in bipolar disorder can help you get your symptoms under control. When to get emergency help. Suicidal thoughts and behavior are common among people with bipolar disorder. If you have thoughts of hurting yourself, call 911 or your local emergency immediately. Go to an emergency room or confide in a trusted relative or friend, or contact a suicide hotline. In the United States, call or text 988 to reach the 988 Suicide and Crisis Lifeline, available 24 hours a day. 7 days a week, or use the Lifeline chat service, are free and confidential. If you have a loved one who is in danger of suicide or has made a suicide attempt, make sure someone stays with that person. Call 911 or your local emergency number immediately, or if you think you can do so safely, take the person to the nearest hospital emergency room. These types of trailer trash women also is a carrier of these types of sexual transmitted diseases. And by the way, if you know that you're a good woman and it's not like this at all, this message doesn't apply to you. But if you know that this topic is you all the way, I recommend that you get mad by exposing who you are, by letting me know that you have a problem with me exposing your funny ass. Sexually transmitted infections. Sexually transmitted infections called STIs like chlamydia, gonorrhea, and trichomoniasis can also cause vaginal odor and discharge. It's stinky, and that's very funky and musty. These infections are typically transmitted through sexual contact and require medical attention for diagnosis and treatments. Symptoms may include vaginal odor, abdominal discharge, itching, burning, and pain during urination or sexual intercourse. Diagnosis and medical evaluations. It is crucial to seek medical attention if you experience persistent or severe vaginal odor, discomforts, or discharge. Your healthcare provider will conduct a thorough examination and gather information about your symptoms and medical history. They may perform a physical examination, including a pelvic exam, to check for any signs of infection. Prevention. Preventing infections that causes vaginal odor is the key to maintaining vaginal health. Here are some preventive measures you can take. Practice good vaginal hygiene. Wash the external genital area with mild soap, such as Ivory soap. Ivory is pure. Even if you wash the inside, it would not affect you or would not hurt you because Ivory is pure. And water. Forget to use water. Don't be afraid of water. Avoid using douches. Some people will avoid using douches, but some ladies want to, so that's totally up to you. Okay? I'm just trying to be reasonable about this. You understand? Because douches could help and it'll keep you nice and fresh and smelling good. Okay? But if you want to, you can avoid douches. You know what I mean? Scented products or harsh soaps. Okay? As they can disrupt the natural balance of bacteria in the vagina. Wear breathable underwear. Okay? Opt for cotton underwear and avoid tight-fitting clothing to allow for proper air circulation and minimize moisture buildup. Practice safe sex. Use condoms consistently and correctly to reduce the risk of sexually transmitted infections, but you can still catch the claps of the crabs if your pubic hair touch a person that has the crabs. Even with a condom on, you still can catch it. Okay? Avoid irritants. Steer clear of perfume products, harsh detergents, and intimate sprays that may irritate the delicate vaginal tissues. Maintain a healthy lifestyle. Follow a balanced diet. exercise regularly, manage chronic conditions like diabetes, and prioritize your overall well-being, as these factors can impact vaginal health. This is my conclusion. In conclusion, it is vital to promptly recognize and address vaginal odor related to infections. Bacterial vaginosis, yeast infections, and sexually transmitted diseases are common causes of vaginal odor. And understand their symptoms. Okay? Diagnostic procedures and treatment options is crucial for proper management. Remember to seek medical attention if you experience persistent or severe vaginal odor, discomfort, or discharge. Completing the full course of medication as prescribed and following preventative measures are essential for effective treatment and maintaining good vaginal health. At Cura for You, a one-stop health care platform, primarily focused on providing patients with the right care at the right price. We offer online services for appointment scheduling, lab tests, and radiology services. Take charge of your vaginal health and contact us today for expert guidance and support. Thank you guys, and you have a good day.